going to do it a little bit differently. This is more my style. Fun fact, what's so special about today? 59th birthday of Singapore. It's the national day, it's the Independence Day. So I must tell you, I want to thank Stephen as well as Adam for inviting me here, but I'm away from my Independence Day celebration, so I'm a little bit sore about that. Okay, I'm going to do it. I think Professor Talisa as well as Professor Yana did a wonderful talk. And I really like Professor Talisa, the way she broke it down. And one of the things she said was, one key message. Now I'm going to see if y'all can catch my key message for today's talk. Now we're going to talk about dengue, and when we talk about dengue vaccine, you cannot not get away from this. This is the dengue fiasco in Philippines, where they looked at it and say, the dengue vaccine killed my kid. So when as a practicing physician, I'm not as smart as you guys. I'm a practicing physician. I joined the dark side to earn more bucks. So I get patients asking me, is the dengue vaccine safe? They read about the dengue vaccine fiasco in Philippines, and then what's the effect? At the end of the day, should you or should you not do it? And what happened after that? This is a paper published in 2018, and then it's written by Heidi Larson. Do you know who Heidi Larson is? Incredible woman. She's responsible for the Vaccine Confidence Project, and she wrote this inside. We cannot wait until the pandemic strikes. We must prepare for the next big one when the trust and cooperation will be key to containing the spread of disease. And this was 2018. About 1.5 years later, we had COVID-19. All the physicians here, all the scientists here, all had to play our part in convincing people to get vaccinated. So because of the because of the dengue issue, there's a dramatic fall and decline in the confidence in Philippines of vaccines. So 93% in 2015, it came down to a pathetic 32%. Okay? And if you want, I really want you all to focus on is the dark red box. In 2018, rather in 2015, how much of those who strongly disagree about vaccine safety and importance? Well, it grew in size. If you look at the purple box or the blue boxes, those who strongly agree, you can actually see that the numbers overall are falling. So what it tells you is, as long as there's some bad news, the bad news kind of affects the reputation. Now, this is the one where I think my vaccines are effective. You have the same problem, strongly disagree very little bit. Then after that becomes really quite terrible, and majority didn't want any form of vaccinations. Who's Heidi Larson? She's the one in charge of the Vaccine Confidence Project. This is what they do. And then there were 2 questions here, and I want a bit of audience participation. This is assessed in 2024. Actually, it's 2023, my mistake. Vaccines are safe and effective. What do you think the Philippines will be saying in the year 2023? How safe would the vaccines be, and how safe are the vaccines? How effective are they? Okay, I'm going to give you the Philippines results here. First is 82-84%. Not bad. They actually got their confidence back. Now, we are in America. What do you think the numbers are? Higher or lower? Spot on. You guys are very good. 76 and 77. Okay? 76 and 77% for USA. Unfortunately, I think going forwards, I think the numbers are going to fall. This is her book, and then there is a nice QR code here. If you scan it, it will take you to a PDF from Lancet, where they did a Lancet book review. It's by Professor Bruce Gillen from Sabin Vaccine Institute. You can read it. It's quite easy. Now, I'm going to touch on into the chronological events in Philippines. So it happened in about 2012 to 2015. There were a lot of dengue cases. They called it a war zone. Some governments then decided to call it a state of calamity, and this is what's happening in the hospitals. 2014 and 2015, there was an increase in the number of dengue cases in Philippines. So when kids fall sick and when kids die, what happens? you lose your votes. The popularity of the mayors, etc., politicians go down. So something came along, dengue vaccine came along in about 2016, and right in the center, there's the President Aquino of the Philippines. So in 2016, they decided to launch the vaccine in Central Luzon and Calabazon, Metro Manila, 700,000 individuals. Remember the number, 700,000 individuals. It seems to be the solution to the public health crisis, number of dengue cases. But what happened is Sanofi did a look back, looking into the NS1 antibody, and they found out that if you gave the vaccine to the dengue naive individuals, you ended up with more problems. And with that, the backlash came. So in 2017, the dengue vaccine was suspended, and then Sanofi passed it and said, hey, wait, dengue vaccination doesn't cause more severe disease. And the Public Attorney's Office, the PAO, they started filing criminal charges against the former health secretary, and there were criminal complaints against the incumbent health secretary, blah, blah, blah. So the whole thing just went out of control. So this is to let you dissect it and look at it. This is actually the press release. And it says this: DOH, Department of Health, confirms dengue deaths after taking Dengvaxia. So this is the words which I took off from the report. Health Secretary reviewed findings of the PAO, indicated the dengue shock syndrome led to the deaths of most of these children. And these were the words in verbatim. PAO exhumed the bodies of the children. So far, the indication is that their deaths were consistent with dengue shock syndrome. If you look at the words consistent with dengue shock syndrome, is it really confirms? So that's the PAO, that's the Philippines Attorney Office, who actually did the assessment, but then after that, you have their own doctors who do the assessment. So death is consistent with dengue shock syndrome, but the charts of some of the children show comorbidities, which means there were other illnesses. So we're trying to clear out the other diseases to see if they were the cause or to hasten their deaths. So that's the Philippines Attorney Office. And then this is where the University of Philippines, as well as the Philippines General Hospital, they did their own assessments. 14 kids that died. And then of the 3 cases, this was in Philippines, there was in Tagalog, translated by the press. 3 cases were found to have causal association. They died of dengue. Even if they were given Dengvaxia, 2 of them may have died because of vaccine failure. Most of them only had 1 shot. Now, most of the vaccinees died because of other diseases that happened to develop after getting the last shot of Sanofi passes Dengvaxia. If you look at it, I think Dengvaxia was given the wrong name. It was blamed inappropriately. I was one of 3 doctors who were asked to evaluate the cases. So the attorney office was asked to evaluate, then the Philippines University was asked to evaluate. I was one of 3 which Sanofi Pasteur tried to get in as experts to try to go through the cases. This was before the days of Zoom. There was a conference call over the phone, and the chairperson of the meeting said this: we only have 3 lines of information for all these cases. Young man, or no, the young child comes in, collapsed, no blood tests, etc., died. Recent dengue vaccine, this death is due to dengue vaccination. That was all you had. So we couldn't come up with anything conclusive. We couldn't come up with a good explanation as to the cause of it. The meeting was called off and said you can't do anything about this. But that was how bad things were. All the deaths who died, all the children who died, they didn't have a proper assessment of what were the circumstances. Simply because of death, because of a recent Dengvaxia, they blamed it on that. So after Dengvaxia is COVID, and people were asked to take COVID vaccines. But if you look into the mood and the mood of the people then, you realize that the medics were critical of the government. They're saying they don't allow the Filipinos to choose the type of coronavirus vaccines they want to receive. We understood why. the vaccines were in short supply. Okay, the medics parted concern and they were upset, and then they went on to buy millions of doses from China's Sinovac despite the absence of reliable data, incomplete clinical trials. This sort of things will discourage people. Okay, I'm going to highlight this to you. And so what the doctor was saying is, they want trust. Okay, this is what they said in quotes. Let me go back here. If the emergency use authorization comes out and the process is transparent enough, as a health professional, I'll consider it given the urgency of pandemic, by Dr. Medina from the University of Philippines. So at the end of the day, what the Filipinos wanted for COVID was actually trust. And what they really wanted for dengue is trust. COVID uptake, this is a paper published in Philippines. Stephen saw me present this the other time when we're in Lisbon together. These are the different countries. Singapore is really ridiculously good at 99.1%. I'll tell you the secret why. Singapore government knows what Singaporeans love. We have two passions, food and shopping. Bar them from shopping, bar them from eating out, and they will all come vaccinating. So that's what they did. If you are not vaccinated, you can't go out to eat and you can't go out for shopping. Okay, so this is why Singapore did very, very well. The rest of the countries, there you go. Each countries are a little bit different, but if you really look at the right, this is the booster vaccines. The booster shots uptake were actually quite pathetic, and Singapore goes out at 77.7. Why? Because you didn't need to have your booster shot if you want to go out to eat and shop. Okay? This is a paper. It's done in Vietnam, Indonesia, Philippines, Malaysia. And what they did was they looked at the different brands. We are brand conscious. Between Hermes, LV, Gucci, well, I know my choice. Okay, so there's Pfizer, Moderna, AstraZeneca, Sinopharm, and you can see that they were different. But if you look at the axis, 100% is the top. 20 to 30% refuse to take the vaccines at all. They're not willing to take the vaccines. And then Pfizer is a little bit similar as popular as Moderna. Then the rest of the vaccines come along. Sputnik is right at the bottom. Brand matters. And the elderly are not even willing to participate in the vaccination. There's about 10 to 15%. We are not addressing their concerns. We are not winning their trust. So this is something which I like to emphasize. If we know what is important and the reasons why people vaccines or why people do vaccinations, we will emphasize them. So can we leverage on this, that things are important for their health, and those things which are not very good, we try to allay their fears, and these are the things which we talk about during vaccinations. And what we're trying to do is to build on trust. What are some of the concerns on the physiological barriers of vaccines? Allay their fears, build on trust. We need to talk about their side effects. They're worried about side effects. They're worried about being unsafe or ineffective, not enough vaccine evidence, impact on pregnancy, fertility, and religious concerns. These are very, very similar answers to what was presented earlier. Most people are concerned about the possible side effects, vaccine safety, and religious concerns. They look into Southeast Asia. What are the factors that actually affect the vaccine hesitancy? Make a guess. Rural areas, they don't like it. Okay, people saying areas. Then about education as well. If you have below primary education level, that's below grade 6, there's a highly unlikely for you to get vaccinated. But those who are post-secondary level, some of them don't as well. I realize that some of the anti-vaxxers leaders who's championing anti-vaccines worldwide, they even have PhDs. Low education level seems to be a matter. If you're unemployed, you're more unlikely to take the vaccine. So what are the factors influencing? I like to reinforce things like when you get vaccinated, it helps them. helps the individual, helps the society. People like to do things for the family as a society. They like to say that it comes from recommended from a trusted source. So that's where Professor Yana talked about it. Your own personal strong recommendation. Vaccination must be done conveniently and ideally free so that it will drive out the vaccine uptake. The aftermath of dengue. So the upper blue line is actually the, hold on, there you go. Okay, 2018 is there, 2020 COVID is there, the measles first dose vaccine. When it came down to 2018 with the aftermath, you realize the vaccine for measles came down. But the pneumococcal final dose was still rising. So majority of people were still accepting vaccines in Philippines, okay, all the way, and then you could still see that it's starting to go up all the way to 2020. In 2020, COVID struck. With the COVID effect, the number of vaccines all came down because everyone was just focused on getting COVID and surviving through COVID. Now, what I really wanted to emphasize is this. 80% of the people in Philippines took the vaccines. We're missing out 20 to 25% of them, and this is what we really need to focus on. With the COVID vaccines, every one other country, their own regular immunization became disrupted, which is a bit of a problem. Okay, this is actually from Professor Sophia Reyes. She's actually from Duke and US, Singapore. She talked about the lessons. I'm going to just go through very quickly. We need to build on trust, cultural humility, appropriateness, promoting vaccine uptake. And it's about community engagement. How? We need to get the community leaders into the picture and in turn get the community engaged. Multidisciplinary collaboration. Professor Yana talked about it, and it is all about all the stakeholders being involved. And that we must engage all members of the community in a way that fosters trust. And this is Takeda-sponsored piece of work from, and it's done by Joanne Yung, who's from Singapore, a friend of mine, and looking into the dengue, knowledge, attitudes, and practices towards dengue fever, vaccine, and vector control. Overall, there's a high willingness of 53% to take the vaccine. Latin Americans are doing better at 59%. Asia Pacific is 40%. What are the biggest concern? Two. Money, how much will it cost? And do you actually trust the healthcare system? I'm going to skip through this in interest of time. We had a Swiss cheese model yesterday. I'm going to say a Swiss cheese model again. All of us, all the individuals have different reasons to say no. It could be contextual, it could be an individual, it could be a vaccine. And if any one of them misaligns themselves, the individual is unlikely to take the vaccine. Towards the end, ready. This is published quite recently. It's a newspaper article published in June 2024. Does Malaysia need a dengue vaccine? Malaysia is frightened of the same fiasco in Philippines. So one of the doctors is saying need to take the social cultural approach. How are we going to get it to society level? We talk about emotions and desires of those people and tangible. That's where Professor Yana talked about empathy. Consistent across all platforms. This is exactly what Professor Yana talked about. Public health messengers should be diverse, all ages, genders, backgrounds, ethnicity, and nationalities. I'm a bit of a public figure in Singapore. I was rather upset when 20-year-old, 30-year-olds don't know me. They don't know me because the way in which I approach the people, the public, is through the national news, media, etc. For the kids, for the young people, they go through TikToks and they don't listen to me and they don't get to see me. And then as part of a communicator for COVID, we had to fight fake news. And Heidi Larson said this: we don't have a misinformation problem, we have a relationship problem. So the thrust of the talk actually is to get trust of your patient. I like everyone to try to build trust, and that's what I do in my communication lectures. One of the problems is, as a doctor, we would just try to listen, but we listen not to understand, we listen to reply. So Larson actually asked us to listen to these rumors, recognize what these people are saying, and try to review the deeper issues so that in turn, we can actually tackle it better. This is taken from Stephen. Vaccines don't save lives, but vaccinations do. So you have a great vaccine, great. You can lower down the numbers of dengue, great. But if the patients don't take it, then it's useless. This is from also, where it go? Okay, no, know what? I'm going to stop here. We're just in time. Yes, I got 15 seconds more. Thank you very much.